The largest organ in our human body is our skin, and it tells us our most visible stories. But we often handle our skin issues ourselves, be it pimples, acne, or any other issues. In today's conversation, let's uncover the expert insights with Dr. Deepthi that go beyond our at home treatments. Welcome to Beyond Her Story on Wonder Woman Wednesday. Today we have Dr. Deepthi, a renowned dermatologist and accomplished academic recognized for her expertise in advanced dermatological treatments such as lasers and vitiligo surgery. As a founder and consultant at Ashraya Skin Neuro Clinic, she leverages her rich experience to enrich her clinical practice. Dr. Deepthi's commitment to the field is further reflected in her significant contribution as an editor and author for numerous esteemed dermatological textbooks and scholarly articles, making her a respected figure in the dermatology community. And today we will speak about the causes, treatments, and misconceptions surrounding acne in both teenagers and adults. So let's get started right away. Welcome, Dr. Deepthi, to Beyond Her Story on Wonder Woman Wednesday. It's such a pleasure to have you here.
Hi, Sneha. Thank you for inviting me.
Yeah, we'll start with the questions right away because I'm sure people want to know about acne, pimples, and skin issues that we normally have. So, getting to the basics of it, what is actually acne?
See, acne is a medical term. Acne is also called as pimples. Pimples is a common name. Okay, acne is a medical term. Both are same.
Okay. It's not that acne is big with swellings and pimples are the smaller versions of it?
No, not at all. Acne comes with various severities and grades and different types also. So,
it's acne at different grades, is it?
Yes.
Okay. And what are the common causes, Dr. Deepthi, that people get acne?
See, pimples or acne, since the cause is not a single factor, it's always a multifactorial. Okay, genetics play a role. Okay, if you have a family tendency, if a mother or father has acne, then you are more prone to develop acne. And in addition, your lifestyle and as well as under the influence of hormones, one can get acne. Apart from these things, some oral medications, for example, any ladies taking oral contraceptives or birth control pills, they can also get during pregnancy. Some women get more acne.
Yeah.
And in addition to that one, certain parallel procedures like skin whitening procedures where they use topical steroids in them, they can also cause pimples. So this is broadly, if you want me to tell, in a genetically predisposed individual under the influence of hormones, if your lifestyle is not proper, definitely anyone can get pimples.
Okay. And when you say lifestyle, it involves what you eat.
Yes, exactly. 5 factors affect the development of any pimple.
Okay.
First thing is the diet you consume.
Okay.
Second is exercise, how much exercise you are doing on a regular basis.
Okay.
Third is the weight fluctuations, which nowadays we are seeing a lot.
Okay.
And last but not least is stress factors and sleep.
Okay. So these are the factors
which contribute for the pimples.
Okay. And it's not just teenagers who get pimples, right, or acne. You see adult acne also. So how is the adult acne different from teenagers?
See, when one hits puberty, our body starts producing hormones.
Okay.
So at that stage, under the influence of hormones, special glands called sebaceous glands, these are nothing but oil producing glands in the skin.
Okay.
They become hyperactive and the pores can get clogged, leading to different stages of acne. Okay. So that's why in teenage, this is very common condition. But when compared to the teenagers, the adult onset acne, which we call sometimes hormone acne, is a little bit different. Especially in women, we see many hormonal issues like thyroid disorders, PCOS. They have other problems also like baldness, and sometimes they may have unwanted hair on the face along with acne. So this kind of special acne usually happens mainly along the jawline and neck. Along, if you see such women, they might have unwanted hair also in addition. Sometimes there will be darkening around the neck also. So teenage acne is just common acne, since where the pimples can happen anywhere on the face. Most commonly they happen on cheeks. Okay, but adult onset definitely they happen along the jawline, chin area more.
Okay, but is it possible that adults also have pimples on their cheeks without hormonal conditions? I mean, I'm asking because I have a lot of acne issues, which often come and go. All my hormone levels are all good, but my skin is very oily. I sweat a lot, so I keep getting one off here and there. So, do they also contribute to adult acne, or
Here, I want to address one fact that all pimples are because of hormone imbalance,
Okay.
irrespective of whether it is teenage acne or adult onset acne.
So some imbalance.
Some amount of imbalance happens. That is always under the influence of our lifestyle. Okay. Like in adults, basically, when we pass, like our lifestyle doesn't allow good sleep patterns nowadays, especially, and especially when you are consuming high carb diets and dairy products, they contribute for this acne. Okay, so again, I told you, in a genetically predisposed individuals, definitely pimples can happen irrespective of whatever age under the influence of hormones. Hormone imbalance will be there. Okay. The blood test which we do for all these hormone assays, we are going to assay only at a particular timing, isn't it? Okay. At that time, your hormones may be normal. Okay, so don't rely only on the lab test that you are like. If they come normal, don't think your hormone levels are normal. Okay. Okay, if a lady has many pimples, unwanted hair, and if they do the test and those tests come normal, doesn't mean that they do not have hormone imbalance.
So, Dr. Deepthi, what are the preventive measures that people can do to take care of the acne issues that they have?
This is one good question, like Sneha. Maintaining, I have already emphasized that maintaining a healthy lifestyle is very much essential. In addition to that, one has to stick to daily basic routine. There's a basic skin routine, which we advise for the patients, right? That includes first cleansing the face and using a proper sunscreens and moisturizers. You might be wondering that cleansing the face, what we should use. So for acne-prone skin, we usually include face washes rather than cleansers. Okay, there is a slight difference between a cleanser and a face wash. Face washes usually contain, especially the acne controlling face wash, they also control this oiliness on the face. They contain this alpha hydroxy acids and as well as beta hydroxy acids, which AHA, BHA, which you call these days, in a very light concentrations. So what does these acids do means they control the oil production on the face. As a result, your acne gets controlled. So we include these face washes as a part of routine. But one should remember we should not overdo it. We advise our patients to wash their faces once or twice a day, but not more, because when used in excess, then definitely it leads to excessive dryness on the face, which can lead to acne breakthrough. Okay, because your glands will think that there is a lot of dryness, it will start overproducing iron. Okay, so one should not over cleanse their face. Second thing is we are all Indian, like Indian skin is a shade of brown, isn't it? Yeah. So whenever any red rash happens on the face, it is prone to become a dark spot. Yeah, isn't it? So pimples are also like a pinkish or reddish ones. Correct. When they happen, they may turn into dark spots. Okay. So we advise sunscreens as a part of routine. Yeah. So one should use sunscreens, and one should check label non-comedogenic when you are using the sunscreens. And if you are having a very much like oily face, depending on your face, your dermatologist will recommend what type of sunscreen you have to use it. Yeah. For example, a person with a oily skin, we usually advise a matte finish. Okay, so that is suitable. Third one is moisturizers. You may be wondering again, like if I have already doctor like oily skin, then again you are prescribing me this moisturizers. It is very much essential. Moisturizers not only balance the oiliness on the face, but they also act like a barrier repair. They make a barrier. Okay, when you are using all these products, especially to control acne, they all have weak acids as a component. Okay, they cause dryness as a side effect. To counter that, we always add moisturizers, not only to balance the oiliness of the face, but also to act as a barrier also. Okay. When these weak acids they try to dry out your face, they try to balance that out. Okay, so these three fundamental things: cleansing, applying sunscreens, and moisturizer should be there.
Is there a sequence to it?
Sequence, nothing. See, first one, you have to cleanse it. Yeah. You have to apply moisturizer as the first layer, and then a sunscreen. Always remember, moisturizer should be the first layer, and sunscreen should be the last layer.
Okay. And like you rightly said, I think the information that you told about the sunscreen, right, that actually makes sense because there are so many products coming out on the market, right? So we have to be very careful about what we choose, I think.
Yes. So sunscreen is not anything like a universal product. Even dermatologists, we cannot decide this is the best type of sunscreen. Okay. Only we write sunscreens based on your like skin type and the condition which we are treating. Okay. So we decide the SPF and the formulation type, whether it's a lotion based, cream based, tinted one, or a matte finish, depending on your type of the skin.
Okay. Okay. Now I think these are the measures that we can take on a daily basis, right, which will actually help treat this. Other than that, let's say people have severe acne. What are the treatment options that are available which people should look into?
You mean to say for severe acne or for different varieties of acne?
Different varieties of acne also. Yeah.
So acne we clinically grade as mild, moderate, and severe, depending on the severity. Basically, type of pimples and the distribution number, we take it into consideration. Depending on that one, we grade it as mild, moderate, and severe.
Okay.
For example, for mild pimples, only topical creams are enough to control them. If it is in the moderate severity, then we add chemical peels in addition to this, like creams. If needed, we may sometimes add some antibiotics or some other oral medications which control acne. Okay. And for severe ones, it is always multiple approach. We start definitely oral medications. Along with that one, we advise simultaneously we do chemical peels.
Okay.
And along with that one, sometimes we may offer other out-of-box modalities like lasers. These are the recent advances. Okay. Lasers also, or IPL devices, light devices to control this acne. The scientific evidence says that if you treat your pimples at the earliest, then the pimple becoming a scar or a dark spot is less. Okay. Please remember that once a scar happens, however much you will try, it will never be seen. Yeah. So always prevention is better than cure.
Yeah.
So treat your pimples at the earliest and aggressively, so that you will not
Doesn't-
end up with such complications.
Yeah. Okay.
So for severe one, yes, we have to add all these things simultaneously. We start many things so that they should not leave acne scars. Basically, when everyone is concerned about that complication. Okay. Regarding this treatment options, Sneha, I would like to emphasize one more point. This is actually an important point.
Okay.
But see, these treatment options, whatever I talk, it's just like a wide range are available.
Yeah.
Only your dermatologist can decide, like based on your severity and age and your planning for the family and everything. We take into consideration of all these things and then we customize for each patient.
Yeah.
So the treatment which we have advised you may not work for the other patient, vice versa.
Yeah.
So it is better to have an expert opinion regarding these management options rather than treating yourself.
Yeah, I know. I think that is what normally happens, like if somebody is seeing a dermatologist and they say, I'm using this cream, okay, let me also go and buy it and use it.
Yes, I agree that certain amount of social media is helping in educating the patients. It has a positive impact on patients because nowadays people understand that yes, acne is treatable.
Yeah.
And there are various options, treatment options available to treat it. But sometimes if it is overdone,
true.
If people start self-treating themselves, they may land up with the complications or side effects.
Correct. Yeah, very true. So another thing, Dr. Deepthi, which is very common is when people get acne, and especially teenagers, they go through a lot of psychological stress, and they're not able to. A lot of other aspects of their life gets affected because of these issues. So how do you? What are the things that you would tell these kind of patients?
Yes, definitely, I agree with you. Today, this era is definitely social media era. Everyone wants to look good in front of the camera. Yeah. So severe, I have seen many patients with severe acne who they lose confidence and they don't want to socially face any social situations. They try to avoid completely. They shut down themselves. Some people even, since they lost their jobs because they have this severe acne, especially people who work as receptionists, apprentice people, they have lost their jobs because of their condition. Yeah. It's very bad. For all such people, I would like to tell that yes, acne is treatable. The first thing, it is treatable. Please consult. Definitely, it is treatable. And with a healthy lifestyle, and definitely, since whatever reasons you have achieved through the treatment, can be definitely maintained for a long duration. So, acne is treatable. That is the first thing. When such patients come, definitely we spend time with them. Then we advise. Simply, I do not write any prescription. I don't tell them, use this product because of this duration. We never tell. We always tell what is the root cause of the pimples. We explain how we have to maintain healthy lifestyle. For example, exercises and especially this diet. Recently, there is a trend called intermittent fasting. Yeah, isn't it? Yeah. So that intermittent fasting is good in one aspect that it helps to lose weight in a faster manner. The problem is here the weight fluctuations one experiences. Suddenly they go into this intermittent fasting, they lose weight. Once they stop, they gain weight. The same it may rebound back. Yeah. Okay, then your body will not understand how much hormone it has to produce on a regular basis. So your brain will get confused. Okay. So in such scenarios also acne breakouts are very common. They feel I'm losing weight, still I'm I'm not able to control my acne. Yeah. But then I would like to tell that it's just don't only follow this Instagrams and YouTube's about this intermittent fasting, how many hours and all such things. If you really want to lose weight, definitely you need a expert opinion from a nutritionist. Depending on your type and body type, they will tell you the diet. Anything that happens sudden, body may not be able to take it. So that during that phase also, acne breakouts are very common. These things are there. So we explain them regarding the importance of the lifestyle, sleep patterns, and stress patterns. We spend time with them to understand their concerns. Definitely, holding hands helps them.
I think that's very useful information, Dr. Deepthi. Like, as a teenager, even I've gone through that. So, it actually helps if somebody can explain to us, and instead of, just going everywhere looking at trends and things, it's better to have an expert advice. I definitely agree to that. And there are a lot of myths surrounding acne and pimples. So, what are the common myths?
I can number them. There are many myths, definitely, regarding acne. The one most common myth which people follow religiously is they pop up the pimples. One should never pop up their pimples. Okay, when the skin is irritated and then you are trying to manipulate it, people think that when there is a pus, like one stage of pimples, they develop this pus, they try to let it out by squeezing the pimples. It leaves a very bad scar. So we should never pop up your pimples. That is the first one thing. So don't think that you are letting out the pus, the pimple will come down very fast. No, you are doing it in a reverse way. Second myth is definitely people start using this home-based remedies. Apply this turmeric, aloe vera gel directly from the plant, and as well as the sandal paste and everything. If it suits you, it's okay. But sometimes they themselves can aggravate or irritate your face and can create side effects. So don't try to follow this home-based remedies without understanding them properly. Okay. So don't think natural products will not cause any side effects. We have seen many people developing allergy to sandalwood paste, multamity, turmeric, and aloe vera is notorious to cause even acne form eruption, which we call. It itself can cause acne. Okay. So beware of the second myth. And third myth is yes, pimples happen only during teenage years. It's not. It's a myth. It can happen from 1 month old neonatal period, which we call.
So
yeah, it's a menopause age. Like anyone can, any age is not an exception.
No, elderly people I knew, but I didn't know that even
neonatal acne is one special different. Though the causes may be different at different ages, but acne can happen at any age. Okay. So this is the third myth.
Okay. Now, science is advancing and we are getting a lot of newer things.
Yes.
So is there something new in dermatology and
regarding acne?
Acne, which people must be aware of?
Yes, there are many new things keep happening in the science, definitely. I may not tell that it is a new one, but definitely chemical peels, advanced peels have come into the market which can control acne effectively. Second thing, there are light-based devices like lasers. NDI laser helps to control acne. Especially it helps in people whom you don't want to give any pills. Okay, especially severe acne with the big scars and everything. These light-based devices help to shorten the treatment period. Okay. And as well as they decrease the dependency on the pills also for the patients. Okay. So light-based devices is the second one. Third thing is many women they get this acne breakouts just before the periods, menstrual periods. And people with PCOS also will have whatever care they take. Multiple times they get this acne breakout. For such people also we have certain like myoinositol, which we call as some of in the market. Your dermatologist might help you how to use them. So if you take them on a regular basis, they try to metabolism will be corrected, and will try to reduce the frequency of such breakouts.
Okay. Yeah, it's so good to know. Actually, Dr. Deepthi, I think the information that you have provided, it's really good because, like you said, social media era, and you see a lot of things, and you want to try. It's actually you become, you feel like you should try this out and see how it works out. So I think
you try definitely. I advise social media is a good educator tool, definitely, since it educates people.
Yeah.
But before trying it, consult an expert whether you can try this on your face or not.
Yeah.
That is what I advise my patients. Yes, you try. It's a good thing.
Yeah.
But whether it suits you or not, for your severity or for your skin type, let the expert decide.
Yeah, agreed completely. I think after talking to you, I'm getting more questions about the acne part of it. So we have now mostly covered about acne on the face. but does acne occur on the body as well? I think I've seen some, that's why I'm asking you this question. And what is the difference?
Sneha, definitely this acne can happen anywhere where this oil producing glands are, sebaceous glands. Okay. These glands are like in large number on the face. That's why we get pimples or acne most commonly on the face. But they can happen anywhere on the body. Like they can come on your shoulders, back, upper back, trunk region, chest region also, thighs we have seen. Like in people with hormone issues, wherever these glands are there, like everywhere they can get this acne. The truncal acne is one of the toughest condition to treat for us also, and for the doctors also. Basically because of two reasons.
Yeah.
Okay, it is they are present on an inaccessible area.
Yeah.
If I prescribe an ointment, you will apply these creams properly on your face.
Yeah.
Regularly also.
Yeah.
It is easy.
Yeah.
But this is an inaccessible area. So you need somebody to help you.
Yeah.
Okay. So it may not be feasible every time.
Yeah.
So patients will not be complained with the treatment. Second thing is they are tough because of their position and everything. Like they are very tough. They do not respond to the regular creams and such things. And third thing, one more thing is also there. Like if we apply cream on the face, I mean, that cream can stay longer, isn't it?
Correct.
But on the back, once you apply, you are forced to wear clothes.
Yeah.
Okay, most of the ointment gets wasted.
Yeah.
For such reasons, we advise to go for chemical peels. Few sessions of chemical peels, they control this acne very effectively.
Okay.
When in fact the numbers will be such a great number. Okay, it is even economically if you see that pimple creams cost you much more than which you spend on chemical peel treatment.
Okay.
Overall, if you take.
Okay.
So yes, acne can happen anywhere.
Okay. So I think this has been a wonderful conversation, Dr. Deepthi. I mean, like I always say at the end of every podcast recording that I do, that there are so many takeaways. And I mean, what you study, what you read on the net is one thing, but when you hear it from the expert, I think it definitely makes you feel that, okay, there are a lot of things I need to know. And the need to go to an expert and talk to them actually helps you clear out a lot of myths and figure out the right way to do right things. So thank you so much.
Thank you also, Sneha, for giving this wonderful opportunity so that I can educate the patient the right way.
Thank you. I think we'll have more such sessions and, on different topics.
Yes,
We have just covered the acne part of it, but there are a lot of other skin-related things, and I think you are an expert in vitiligo and laser. So maybe we can take up those topics as well.
Sure.
And last thing, if people want to reach you, how can they reach you? And
my name is Dr. Deepthi. Okay, you can visit me at my clinic, which is located in Rajajnagar, prime location near Washing Circle.
Okay.
My clinic name is Ashraya Skin Neuro Clinic.
And we can leave the links.
Sure.
Do you
have a website link? The address is also there.
Yeah. So we can leave the links in the description, and people can reach out to you.
Sure.
Thank you. Thank you so much.
Thank you, Sneha.